Presenting Pharmacy Practice News Meeting Highlights. I'm Dr. Linda Bernstein here at ASHP Summer Meetings and Exposition to bring you a poster by Drs. Courtney Delgado and Brian Sayer entitled Organizing and Maintaining a Functional 340B Oversight Committee in a Disproportionate Share Hospital. And now for our presentation.
Hi, my name is Courtney Delgado. I am the 340B Analyst and Integrity Coordinator at Charleston Area Medical Center. That is in Charleston, West Virginia. Charleston Area Medical Center is a 955-bed tertiary care facility in southern West Virginia. We provide approximately $100 million worth of uncompensated care every year to patients, and we are considered a disproportionate share hospital. We qualify for the 340B program. We needed to come up with a plan to stay very compliant with the program. It's under a lot of scrutiny, both by the government and by pharma or the manufacturers, because they are providing the discounts and want to make sure discounts are going to the appropriate entities. We decided we needed an oversight committee. When you think of 340B, you think of pharmacy. It's a pharmacy discount program. So what we realized was that it extends much further than that. It's about prescription writing. It's about who the providers are. It's about who the drugs are going to. For that reason, it touches almost every department of the hospital. And in order to maintain compliance, you need to involve all of the affected stakeholders. So for that reason, we wanted to bring together a committee who met monthly to oversee and organize the program. We started base level just with pharmacy. Pharmacy taking the leadership, getting trained, and identifying key stakeholders within our organization, including the C-suite, our information technology services, and many other departments. Once key departments were identified, we needed to teach them about the program and let them know how they played a role. So what you need to do to educate the stakeholders on the program is actually explain to them how the program affects them and affects their departments. Because we provide so much uncompensated care to patients, it's important to be able to continue those programs that are providing that care. 340B is one of the ways we do that. So in lining out the programs that are supported and the savings that we receive because of the program, we are able to establish buy-in with our stakeholders or with the different departments that we're speaking to. Once you establish buy-in with your different departments, with your C-suite, with administration at the hospital, it's much easier to get your oversight committee running. So it's very important to lay the foundation of education and then explain the program's benefits to those around you and to the stakeholders in the program. We began meeting once a month with the identified stakeholders. We organized the meetings so that they were a time of 340B re-education, a time to report what was going on within our facility, any changes we made, any problems we may have identified, and also outlined action plans to address those problems. Once the action plans were outlined, we then had near immediate enactment of the plans because you already had a committee of organizers and managers on board who knew what was going on and how it was going on. So after kind of bringing all of that together, we tried to find measurable benchmarks for results of bringing together an oversight committee. Some of the benchmarks we found were that we had a 75% attendance rate to oversight meetings when only given even a 24-hour notice. So if we scheduled it the day before, we still had at least 75% attendance. We wrote a policies and procedures, which included the oversight committee and departments that are required to be a part of the committee. This included C-suite members, senior administration, ambulatory, information technology, pharmacy, and many other departments within the hospital. We also were able to complete 2 successful external audits to our facility so that we knew things were running well and that we were compliant because of the actions of this committee. So overall, an oversight committee takes some work to get started. It takes time and effort to create and to provide education and to explain buy-in to the program for your stakeholders. After that, it's fairly simple to keep it running, have it chaired, and make your 340B entity a more compliant facility and someone who can take action at any point.
We'd like to thank Dr. Delgado for her presentation. For more information, log on to pharmacypracticenews.com. I'm Dr. Linda Bernstein for Pharmacy Practice News Meeting Highlights.